Yad Eben, Vice President Lizer here, welcoming you to another edition of our COVID-19 Town Hall Update. It's good to be here, good to be with you and see you all. And I know many others will be joining you shortly, but as we always do, we open Jonathan Nez is entertaining and is with a high level official here in Windrock, so he'll be joining shortly. So let's open up in prayer. And again, today is June 28th. It is Tuesday. Yeah, thank you, Lord. Yeah, in God, we give you this time, Lord. We praise you, we honor you. We ask your blessing on this time. We pray for wisdom, not only for us as leaders, Lord, delivering news, timely information to the people, Lord. We also ask that the people of the land be blessed, Lord, with the information and with the wisdom, and soon to act and preserve their family as well in their power. But we honor you at this time. We know it's our ability to stay free of this virus, and Lord, your ability to heal us, Father. And so, in God, we give you this time. Uh, be with us as leaders, protect us all, Lord, especially our health officials, Lord, all of them, the doctors, nurses, the respiratory techs, and the EMTs, first responders, Lord, and all those that work behind the scenes during this pandemic, Father. We honor them. We thank you for them and their ability and their gifts, Lord. Thank you for preserving the great Navajo Nation. We do so in your protection, in your healing, and in your provision. We thank you again. Be with us during this COVID-19 Town Hall update. In Jesus' name, in God. Amen. Amen. Well, again, thank you for joining us. It is June 28th, Tuesday, 10 a.m. We usually try to chime in with you all during this time. And certainly, again, our President Jonathan Nez is meeting with a leader, a national leader as well. So we look forward to his update here very shortly. So I'll start with my segment and then pass it on to Dr. Laura Hammett here, who will probably, if not Dr. Jim, when they all join us here. So again, updates, 4th of July weekend. Wow. Happy birthday, America. It's a time, and it's actually an exciting time. We will be having a festivity. Of course, as I say that, it's with great concern as we are still in this pandemic. But we will give you the information to be safe. The latest updates, the latest numbers, we do see a surge in our numbers, but again, I don't will not steal any of the data and information from our esteemed professional healthcare providers and health team here. So, in fact, I'll orient us on this version, June 28th, Tuesday Town Hall update here. Again, it is 4th of July weekend. Independence Day is a time to celebrate the birth of our country here and the founding of our nation with our friends and families. As I say that, I know many of you will gather, if not picnicking, if not gathering to celebrate, then you'll celebrate with others, perhaps going to an event, whether it's a rodeo or some type of festivity, maybe even the 4th of July fireworks, which will be this weekend. So we ask you to remain vigilant upon your surroundings, still using your mask and maintaining social distancing and proper hand sanitizing and the sanitizing of common use areas, amongst other things. So we'll leave that to our health professionals. But the messaging has not changed, and we're going to be giving you all of the latest safety tips, and again, reminding you all of our measures that have been enacted by our public health emergency orders. And again, we'll have those here very shortly. Please stay safe while attending the Navajo community events all around the nation. Be aware and alert of your situation, your surroundings. Also have a partner to experience the festivities and be sure to make it home safely. No distracted driving, texting, drinking and driving under the influence here, reading, and then just basically just be alert as you're driving. And let us all have a safe and joyful 4th of July weekend. Staying home on Navajo is actually the safest way to enjoy and celebrate this weekend's holiday. So those are for those that are inclined. Best way is to stay home, stay safe, and potentially save lives here during this COVID-19 pandemic. Um, one of the things for buying Navajo and buying local is one of the things that we always tout, and yeah, I know it comes with much dialogue, it comes with much conversation, but the reason why we say that is that when you do have the finances and the money to especially after those that have received their hardship checks. You continue to frequent your local Navajo uh, owned businesses and the Navajo establishments here on the Navajo Nation. Again, we all win when you do more of that, and so that's the preface on buying Navajo buy local. More money on Navajo benefits the nation greatly with new business opportunities. Also, even 1% of all of those purchases goes to purchasing emergency response equipment. If not vehicles, then certainly equipment that our EMTs need, that our firefighters need. And so, again, it's just a win-win. So, I guess staying positive with that aspect. We've always said that for years and years by Navajo, by local. And so, when you do so more often, the opportunities will come, and there is no doubt to that. So, we appreciate you all for doing so. I want to give a shout out to the Navajo Nation Division of Economic Development for hosting the Navajo Expo Fair that's being touted here this 4th of July weekend, the Agricultural Expo and the PRCA Rodeo in Window Rock here from July 2nd to the 4th between 10 a.m. to 6 p.m. There's also events in Kayenta as well. I believe there's a rodeo, and any Navajo community where there's a crowd, there will be a flea market and there will be food stands. So we again urge you to be safe in frequenting these and enjoying the the festivities and the opportunities to buy, whether it's jewelry, whether it's supporting Navajo families and the flea market. Continue to be safe out there. We also are working very hard, very feverishly, discovering new business opportunities and discovering what our Navajo economy is doing there over at the Division of Economic Development. So I appreciate the team there, fine team there, doing very well for the Navajo Nation. On a larger scale here, the news in the United States nationally. On Friday, June 24th, 2022, the Centers for Disease Control and Prevention, the CDC, recommended the Moderna COVID vaccine for children 6 to 17 years old. Both the Pfizer and Moderna COVID-19 vaccines were approved for children as young as 6 months last week. A panel of independent experts advising the Food and Drug Administration is set to recommend on Tuesday, today, whether to update existing COVID-19 vaccines to target a newer version of the coronavirus in a booster shot that Americans could get in the fall. So please stay tuned. You may hear some updates from our team here shortly. The Pfizer and Moderna, the two major vaccine manufacturers, have both been studying an updated vaccine that targets the Omicron variant, which became dominant last winter. The Biden administration has made clear that it needs Congress to provide more money so that if the FDA clears updated boosters, the government can buy enough. That's usually how it works. You got to plan and make sure there's money available. They want to buy a booster for every American who wants one. And Dr. Anthony Fauci, the government's top infectious disease expert, told Congress last week more research funding also is critical to create better next generation vaccines, such as the nasal solutions that you might have heard about. And these types of treatments might better block infection in the nose or more variant proof booster shots. So that's the latest nationally. A little bit closer to home, an Arizona Department of Health Services announcement of the expansion of the availability for young children and noted that there are about 390,000 children in Arizona between 6 months and 5 years old. Since the Pfizer vaccine was first approved for 5 to 11-year-olds in November, a total of 205,000 Arizona kids in the age group have received at least one dose of the vaccine. As of, and these numbers, we used to give daily updates for these numbers here, but right now we just have a picture, a window of in time during this 2-year pandemic. Total positive cases in Arizona, again, putting it in perspective, Arizona is pushing 7 million total population. Total positive cases, 109,053 people have been tested as positive here. A little bit closer to home, Apache County, 23,426. Navajo County, 39,699. And Coconino County, 45,964. Again, these are the new COVID-19 updates, and more will be presented. Updated figures will be released tomorrow. Colorado, as of Monday, the state 7-day positivity rate was 11.13%, which is down slightly from 11.20 1 week ago. The positivity rate measures the amount of COVID positive tests to the total amount of tests taken. Total positive in Colorado, 1,528,939 people have tested positive for COVID. Not sure how many have recovered, but hopefully we can get those numbers as well. New Mexico, our eastern neighbors here. As of yesterday, June 27th, total positive cases, 560,929. San Juan County, there in northwest New Mexico, 43,031. And McKinley County, 27,300. Utah, total positive cases, there's no news for Utah there. 975,507. This was as of June 23rd. San Juan County there in southeast Utah, 4,181 total positive cases. And our own Utah Navajo Health System checking in at 2,090 positive cases over this 2-year duration. In closing, the CDC said communities with high level of COVID-19 transmission should do the following. Wear a mask indoors in public. Again, the messaging will not change very much. Stay up to date with COVID-19 vaccines. Get tested if you have symptoms. And additional precautions may be needed for people at high risk for severe illness. The Nez Lives of commitment to the Navajo people. We have been and we can continue to do this together. Again, we are all in this together. What does this look like for the whole Navajo Nation? We recognize that navigating this COVID-19 pandemic can sometimes be hard, frustrating, or confusing. But there are many ways to beat COVID, and that includes vaccines, testing, treatments, and COVID-19 safe practices. Thanks to all our community members here that have been what you have been doing. The hospitalizations and deaths of our dear loved ones from COVID have remained relatively stable. So good job out there to our public by and large. And together we can continue to do more. So let's keep prioritizing safety and not give up in this last mile. This mile could be duration very long. It could be very short. But again, our health professionals will give us the updates for what COVID-19, this pandemic looks like around us. And we can't say that, when we beat this thing, but all the signs point that it's getting closer than ever. So the normal or the new norm that we're seeking President Nez is very proud of the people of the Neta here, all of you all. So we continue to pray for you, and we will continue to pray and work like it depends on our abilities and our habits and our actions and our procedures. But we know we'll pray like it depends on our Creator, in God, which we know it does fully. And we continue to advocate for you all in government, advocate, petition heaven, and appeal to heaven for you all, our people all across the land. So Yeah, it has been a pleasure to have been with you. We do have, I'm not sure if President Nez is on the call yet, but um, Dr. Hammett, I believe you are ready to go here. Um, we want to let you know that Dr. Laura Hammett here of the Johns Hopkins uh, uh, facility is here to give you the latest updates. So, Dr. Hammett.
Thank you, Vice President. I wanted to check. Um, or would you prefer me to?
So we'll have Dr. Hammond and Dr. Va, and I don't know if President will join us in between. So I don't have a lot to say, Vice President. I just want to thank you for your time and effort. I know that we do have many of our HCOC members here, and I just wanted to just encourage everyone that we are seeing an increase in numbers, and I think we'll all talk about this as a reminder, all the safety protocols and measures. And there is an event. There are probably several events across the Navajo Nation regarding 4th of July weekend. Which I just want to make sure that if you're hosting an event, there are guidelines in place for outdoor recreation events. There's guidelines for ceremonies. There's guidelines for youth programs. There are flea market guidelines. There are any sort of activities that you think church guidelines as well. And then there are activities that we're seeing. Rodeos are under the outdoor recreation events. And as I scan social media for the Navajo Nation, I just want to encourage people to still wear their mask. I do see, even though just because you're outdoors, it doesn't mean that you can go ahead and take off your mask, especially when you're not social distancing or physical distancing. It's very important to still have your mask on. And sometimes it does make sense that if you're not around anybody, or you're in a competition, an outdoor activity competition, and you're not near anyone, it does make sense not to wear your mask during that time, just because you're not at high risk of getting infected or infecting someone else. And just encourage people to stay home when they're sick. Even though if you feel like you have the flu or the allergies, we are seeing cases rising. And what I'm hearing from some of our case managers, and also just calls that we receive on what we monitor, or there are people that are sick and maybe not really concerned that they might think they have COVID, or they think they might have the flu or something else, or just a sore throat. There's sort of that understanding that we need to still make sure that while you're out and about this weekend and celebrating, we do have holiday guidelines on the Navajo Department of Health webpage, just to remind everyone that those guidelines are in there. They are there to protect everyone. And also getting your vaccine is what's going to be very important. And I think Dr. Va and Dr. Hammett will allude to that as well. So Akiheta is Notangi Oshinhota Hastito. I'm the executive director for Navajo Department of Health, and now I'm going to hand it over to Dr. Hammett. She is with the Johns Hopkins University and also a member of our Health Command Operations team. So take it away, Dr. Hammett.
Dr. Jim, Dr. Hammett. Sorry, this is Jared. We're ready with President here.
You guys wanted to say hi on the phone. It's multitasking. Nah.
It's starting now.
Okay. Hey, everybody. Jonathan is here. We appreciate Vice President doing the town hall and everyone getting updates. As you all know, every Tuesday at 10 a.m. we do the town hall meeting. Today we are in Gallup, New Mexico at the CBOC. We appreciate Senator Heinrich, Senator Ben Ray Lujan, and others for advocating to keep the CBOC open here on the Navajo Nation. Of course, we know throughout the pandemic that a lot of our veterans are having a difficult time getting services, and keeping this facility open is a big priority for the senator. We are here with Secretary McDonough of the Veterans Affairs, visiting Gala, one of the cabinet members of the Biden-Harris administration. And we also have the senator here with us. He's going to say hi. Keep wearing the mask, social distancing, and we just ask that for the 4th of July weekend, just be safe. If you're doing some events out there, please let everybody know to wear their mask, to social distance, and we'll have the senator come over and say hi. Senator Heinrich, ladies and gentlemen.
Hello, everyone. It's great to be here with the president today, and it's great to be here on a day when we can announce that, this CBOC is going to remain open and remain servicing all the incredible veterans from around the nation and this part of the state. So thank you all. Thanks for always standing up for your veterans. That's why we're here today, and it's really an honor to have the secretary of the VA out in our part of the world and really seeing the challenges that we have, making sure that our vets get the healthcare services that they've all earned and deserve. So thank you all.
Good morning, everyone. I guess it's still morning. This is Rosalind Soda. I'm just director for the Navajo Area Indian Health Service. We are also joined here with President Nez and congressional staff looking at the VA services. We know that services for our Native American veterans are very, very important, continues to be our priority with the Indian Health Service to strengthen our partnership with the VA. In addition to that, we also want to remind everyone that our cases are going back up for COVID. Yes. So please wear your mask, wash your hands, and all of those safe practices that we've been using for the last 2 years. So thank you. Take care, everyone.
All right. Thank you, Rose. And thank you, Senator Heinrich. Appreciate you all being here. And guess what? We have a special guest right now. One of the cabinet members for the Biden-Harris administration, the Secretary of the Veterans Affairs, Secretary Donahue, is going to say hello to the Navajo people. Come on over, Secretary.
Thank you very much, Mr. President. And I say to all of our Navajo brothers and sisters, Yate. I'm sure happy to be talking with you today. I want to just make sure you're aware of one thing that the Navajo Nation is leading on. It's a new project called the Tribal Representation Project, which will allow the Navajo to have their own authorized veteran service officers. Those officers will help ensure that our Navajo veterans can get their claims at VA handled very quickly and managed from the Navajo veteran service officers. So I hope you veterans, especially you veterans who served in Central Command, in that big swath of land from Somalia in the southwest to Uzbekistan in the northeast, during these 30 years of war, going back to the first Gulf War, I hope you will go in and apply with your Navajo veteran service officers for your claims for burn pit exposure. Okay. Thank you very much for the chance to talk with you out here. Thank you.
All right, ladies and gentlemen, that was the Secretary of the VA here in Gallup, New Mexico, the CBOC. And, appreciate everybody. I know this is not COVID related, but we're just bringing it live to you. We're here in Gallup, New Mexico. We're with many of our leaders as well. And, we just want to let everybody know 4th of July is a lot of events are happening. We even have Representative Garcia here, the state of New Mexico. He'll say a few words and say hi to everybody too. This is being streamed all across the Navajo Nation. So, these are events that are taking place right in between getting updates for our Navajo people. But 4th of July weekend, wear your mask, please. Continue to social distance. And a lot of these events are going to have PPE stations. So they'll be handing out masks, hand sanitizers, and the like. So just be careful. We're seeing an uptick in cases, but because of each and every one of you, we can keep it down. We have our Veterans Administration, our cabinet member, I guess Secretary Donahue's counterpart, right, here on the Navajo Nation, my cabinet, our cabinet member with Vice President Mr. James Erline. So come on over, Jim. Say hi to everybody and give it an overview of what's going on today.
Good morning, everyone. Yate. So, as President mentioned, this is Jim Zwerline, Executive Director of the Navajo Nation Veterans Administration. As the President has mentioned, as you have already seen, we are meeting today with Secretary McDonough from Federal VA and from Washington, D.C. We spent yesterday and today meeting with him talking about issues relevant to veterans here in New Mexico and specifically here on the Navajo Nation. So at this time, we're about to head over to a town hall where the secretary is going to be available for answering questions over at University of New Mexico here in Gallup. So with that, everybody stay safe, as the president mentioned, especially during the 4th of July holiday. And thank you, everybody.
All right, Jay-Z. I guess I can call him Jay-Z. Jay-Z, and we got Representative Garcia here is going to say hi. Everybody knows, those of you that are in New Mexico, Pueblo Pintado area, this is your representative for the state of New Mexico. Representative Garcia.
Thank you, President. Thanks for the opportunity to speak today. This is a huge, the sea boxes are not closing. That's very, very important to our communities, to our Native communities especially. And we need to address a lot of issues that are facing our veterans. Number one is transportation. We need to address these issues. I'm glad the sea box is open. I'm glad the president was here today. I'm glad I could speak here. It's an honor, and I look forward to serving you people. You know, I am a state representative for House District 69, which covers I got 9 chapters that I covered. I'm not going through them, but I'm here to serve all the people in the state of New Mexico, especially the Navajo Nation. Thank you. Thank you, Mr. President.
All right. Our Representative Garcia, thank you so much. And a lot of leaders here at the Gallup CBOG. We're headed to University of New Mexico right now. And thank you for watching. Be careful. Have a wonderful 4th of July weekend. There's going to be fireworks happening in the community. So check out our social media page. We'll be putting a flyer up on the 4 days of fireworks, just like last year. We'll be having one in Tuba City, Chinle, Window Rock, and Shiprock. Have a July weekend. Back to the studio. Thank you, Dr. Hammett. God bless.
Dr. Hammett, you're on mute.
Thank you. Thank you, Mr. President. It's an honor to follow such an esteemed group. Shea A. Laura Hammett, Yenishe, Johns Hopkins Center for American Indian Health, Banishnish. As Dr. Jim said, I support the Health Command Operations Center for the COVID-19 response, and I'm going to share a little bit of information this morning just about COVID-19 among children, exciting events that have happened this past week related to vaccines for children, and also talk a little bit about testing and the importance of testing early to access treatment. I have some slides that I'm going to share here. Let me just see if this will work. And, oh, let's see, it's not. Oh, it won't let me share for some reason. So, but I will talk briefly. Dr. Va, I don't know if you can pull up slides or not. Let me just see here.
Let me try to do that for you.
Okay, thanks. So I can get started just with the really exciting news that happened this past week, which is that vaccines are now available for children 6 months to 4 years of age. As a mom, as a pediatrician, as an auntie, this was really great news, and very happy to be able to extend that protection to all of our loved ones, including children who do remain at risk for COVID-19. Thank you very much, Dr. Va, for pulling that up. And if we can, thank you so much. So vaccines now available for the whole family. I know there's been some confusion around booster doses and oh, thanks, Dr. Va. If we could just go back to slide 1. Thank you. I appreciate your help with that. So I know there's been some confusion around booster doses, so I just wanted to summarize here. Booster doses are recommended for everybody 5 and older, and a second booster is recommended if you're 50 and older, or if you're 12 and older and are immunocompromised. So really important. This is really the most important thing that we can do right now to prevent severe COVID-19. Just a little bit of information as these vaccines for children have now been approved, both for 6 months to 4 years old, as well as the boosters for 5 to 17-year-olds. I want to share some data on COVID-19 hospitalizations among children in the United States. And you can see on the next slide here that children are being hospitalized. These are the rate of hospitalization. And the red line are children 6 months to 4 years of age. And the dark blue line, which is that next peak that you can see there during Omicron, are the adolescents. And in the lighter blue line are children 5 to 11 years of age. And you can see as we've had this more recent wave here at the end of in April and May and June, we've seen an uptick in hospitalizations among US children. And on the next slide, we can see another really important reason to extend these vaccines, although COVID-19 disease in children, it can be disease even in infants and children or otherwise healthy who have any underlying conditions. Right now, over the course of the pandemic, COVID-19 has been in the top 5 causes of death for infants and for adolescents. So this is an important preventable cause of death in children, and these vaccines are highly efficacious at preventing severe disease. If we think about the other routine immunizations that we give for children, and we can see on the next slide, most babies get routine immunizations at 2, 4, 6 months of age, and then get booster doses when they're 12 to 15 months of age for vaccines such as hepatitis, meningococcal disease, varicella disease, rubella disease, rotavirus disease. Those are all routine vaccines that we give. You can see the number of preventable deaths per year in the United States prior to the recommended vaccines in that bottom row on that table. So for each of these different diseases that we now have vaccines available to prevent the disease, you can see that COVID-19 causes, on average, more deaths per year than all of these different other vaccine preventable diseases. So just as we do for the other routine immunizations that we give at 2, 4, and 6 months of age and booster doses, the COVID-19 vaccine is really important to help protect our young ones. It's not only important to help protect young ones, but it's also important to continue booster doses for people who are elderly. And you can see on the next slide here, this is the rate of deaths among people who are 5 and older based on their vaccination status. Unvaccinated people are shown in the black line there, and vaccinated people are in the blue line there. And these data show that unvaccinated people were more likely to test positive and had a 6 times increased risk of dying from COVID-19. When we look at the next slide, this is really focusing on getting the benefit, showing the benefit of that second booster, which is recommended for people who are 50 and older. And here we can see the rate of death in unvaccinated individuals, 50 and older, in that black line at the very top. And then the blue dotted line, the rate of death for individuals 50 and over who've had a primary series only, lower if it's a primary series plus 1 booster, but people are most protected. The lowest rates of death are seen in those individuals 50 and older who've had a primary series plus that second booster dose. So among people 50 and older who are unvaccinated, they had a 42 times higher risk of dying from COVID-19. And among people 50 and older who had a primary series and just one booster dose, they had a 4 times higher risk of dying compared to people who had that second booster dose. So we really want elders, in particular, people who have an increased risk of severe disease, even people who are 50 and older and are healthy and don't have underlying conditions, are recommended to have that second booster to provide the best protection. And we even have data on the next slide, specific from the Navajo Nation. These are data from a study that was approved by the Navajo Nation Human Research Review Board that enrolled Native Americans in Chinle and Tuba City, as well as White Mountain Apache tribal lands and in Alaska. And you can see in that graph, vaccine effectiveness is very high. The vaccines provide excellent protection, but protection does wane over time. So those boosters are really important to maintain protection. And so if we go to the next slide, just to highlight the importance of booster doses, of protecting our kids and our young ones, protecting everyone in our whole family by getting vaccines, which again, I'll just throw up that summary slide as the last slide, which shows who's eligible for a primary series, which is everybody now 6 months and older, a booster for anybody 5 and older, and a second booster for anyone 50 and older or who is 12 and older and is immunocompromised. The other topic that I wanted to touch on today is and I don't have slides for this one, but is the importance of testing early for accessing treatment. We know that effective treatments are available. There are oral treatments that are available, but they must be started within 5 days of symptom onset. So it's recommended to test early. If you have symptoms but have tested negative, repeat that testing 1 to 2 times over the course of the symptom onset, so you can access that treatment within 5 days of symptom onset. Tests are available at CHR offices, at IHS and tribal county programs. So free home tests are available, or you can go into an IHS or tribal health organization facility to get testing at the facility. And really important to report those positive tests into the facility so that you can determine whether whether treatment is available and receive care that you need. And with that, I will wrap up. Thank you so much.
Thank you, Dr. Hammett. Hi, this is Dr. Va. I'm calling in from Chinle Service Unit, and I'm on this call on behalf of our IHS area office partners, as well as our IHS partners that have been a part of this response and had this privilege and opportunity to continue to work with our Navajo Nation partners, as well as Dr. Laura and her team as part of this, this HCOC unified response in dealing with COVID-19. Thank you so much, Dr. Hammett, for providing that overview of vaccines and the importance of testing early and treatment. And I understand that Dell, our epidemiology lead from Navajo Nation, will also be providing a little bit more details on where we are in this pandemic. But just in brief, just to provide you a brief idea of where we are and what phase we are in this pandemic, is that, as Dr. Jim and Dr. Hammett and others might have, and even Vice President Leiser mentioned, is that yes, we are in a surge and likely fueled by the variant of Omicron. And so we are seeing cases high, but what we're not seeing is high levels of hospitalizations and high levels of deaths. And that's really an indicator of where we are in this pandemic. And where we are is that we actually have effective control efforts, meaning vaccinations and treatment that work. And so, even though we're not yet endemic, because COVID-19 is still evolving and is still not predictable in terms of like when to expect these surges and how these surges may behave, what we do know is that our control efforts work. And so we are in a better place today than we were in March of 2020. The other thing I just want to underscore is this time of celebration, because finally, in this pandemic, we finally have vaccines to the smallest and youngest people in our population. Literally, we can vaccinate entire families, and we can vaccinate our entire population that we serve. And so let me just share this with you, and just to really summarize, what this means. And this has already been mentioned by Dr. Hammett, but just, to simplify it, to summarize it, COVID-19 vaccines at this time is available to everyone ages 6 months and older. Seriously, the entire population, whole families. Now, the first booster is available to everyone 5 years and older. And as Dr. Hammett really detailed very well, second boosters are available to all individuals ages 50 years and older. And so vaccinations are available across the Navajo Nation healthcare facilities, both 638s and IHS partners. And so please go ahead and check in with your local healthcare centers to see if to see what the vaccine schedules are and events near you. The other thing I wanted to provide was, a more personal story. So, I've had this opportunity to work as part of our Navajo Nation Unified Response as to help with the epidemiology team, as well as, from the perspective of a medical provider. And here at Children's Service Unit, I do serve as a medical provider here in our primary care clinic, as well as I oversee our Division of Public Health for Children's Service Unit. I take protecting our communities very seriously. And I also, and I have lots of confidence in these vaccines. And so when the FDA and CDC, and then of course IHS came out with this approval for vaccines, vaccinating 6 months and older, as a mom, I was incredibly happy. I waited more than 2 years to finally get to this point where, our entire families can get vaccinated. Not just for me, but I was just elated and happy for the entire communities that we serve. And so yesterday, my daughter that you see pictured here and my son, who are both less than 5 years of age, got their first vaccine. And so, as a family, I am vaccinated and boosted. My husband's vaccinated and boosted. I've encouraged my parents who are older than 50 to get their second boosters. And then I encourage our patients to stay up to date with their vaccines depending on their eligibility. I have a lot of confidence in these vaccines. Dr. Hammett was able to show you the data that really supports why these vaccines are important to protecting your family. And then lastly, I just want to note that, Children's Service Unit will be holding an event. And the goal here is to really, again, in a time where we can finally rejoice, we want to protect the entire family and get kids ready and whole families ready to go back to school. The event will be on Saturday, July 23rd, 2022. Vaccines that will be given out will be for anyone 6 months and older. And so we will be sharing details and flyers with our Navajo Nation Department of Health, as well as putting it on social media. Also, Tuba City Regional Healthcare Corporation, they have drive-through vaccines clinics. Again, vaccines available for those 6 months and older, Monday through Friday, 8 a.m. to 4 p.m. And then for our other sites across Navajo Nation, we are actively, our IHS partners, our 638 partners, are actively working with the Navajo Nation to update the Navajo Nation Department of Health, as well as the Office of the President and Vice President's website, with the latest vaccine schedules and events around Navajo Nation. And so with that, I will pass this to Del Yazzie, who helps lead our epidemiology team. Thank you all, and I hope you have a great day, and please share this great news with your friends and family.
All right. Thank you, Dr. Va, for the updates. Good morning, everyone. My name is Del. I'm with the Navajo Epidemiology Center with our Health Command Operations Center epidemiology team. I'm going to provide a quick update here on the latest numbers for COVID across the Navajo Nation, 7-day time period from June 17th through the 23rd. And this is our latest chart showing the daily case counts, the blue bars over a 60-day time period, going back to April 25th to June 23rd. As you can see, the daily case counts, the blue bars go up and down. So it does quite vary, the number of cases every day that we report. And that's just been the case throughout the pandemic. The yellow or the orange line is this 9-day weighted center moving average. It's just putting these data points together to give a better look at the trend over time. As you can see, the orange line has gone up over the past 60 days. And roughly about June 6th, we've been on this up and down trend, and we're currently at close to 120, daily cases as a 9-day weighted center moving average. So, but this is kind of up and down, but it's kind of plateauing, and we'll just continue to monitor this for the next coming week, and hopefully it doesn't go any higher. I mean, we are still seeing a lot of cases, but we are kind of on this plateau, and we'll see what this looks like with our next reporting period. Our 7-day infection rate is at 1. Our threshold is at 1, so we're right at 1, and we've been above 1 for a couple of months now. So hopefully this will continue to go down as well. There were 612 new cases over that 7-day time period from June 17th through the 23rd, which puts our 7-day case rate at 386 cases per 100,000 people. Some additional metrics here. The lab-based test capacity, we are now at 27% as our 7-day test positivity rate. This has continued to increase as well. Last week was at 25%, and this week is at 27%. So there were 617 average daily tests conducted over a 7-day period. So there is testing still going on across Navajo. Our other metric here is our hospital capacity. Hospital beds at 58% and ICU beds at 63%. Our threshold for this is at 80%, so we are below 80%, and this rate for hospital beds has remained stable, even though we're seeing an increase in cases. People are staying are out of the hospital and they're not sick enough. So that is actually a very good sign. Our latest vaccination numbers here on Navajo Nation residents only. Completing the primary series, there are 126,548 residents who have completed the primary series, and then Navajo Nation residents who are up to date are at 79,256. So there are 68% of our Navajo Nation residents have completed the primary series, and then about 46% have completed the primary series and are also up to date. These are the two epi curves for the US in the blue line and the Navajo Nation in the orange line. As you can see here on the far right, the latest trends for the US is on this plateau of daily case counts being at roughly about 100,000 cases. It's this axis over here for the blue line, about 100,000 cases for a couple of weeks, and on this plateau. In Navajo Nation, we are also kind of on this plateau with this little peak towards the end here. We'll just continue to monitor this for the next reporting period. And our high number of cases over a 7-day period is reflected here, comparing Navajo Nation here on the yellow line to the 50 states. And the red line, the red bars here are the bordering states, New Mexico, Colorado, Arizona, and Utah. So even within our neighboring states, there are high cases of COVID still occurring with the Navajo Nation and around us. So really the importance of continuing to practice the protective measures is very important. Here's another picture of 7-day case rates across the US. Really within our region is New Mexico, Colorado, and Arizona with the darker shaded blue colors with the higher COVID case rates. And Utah is also still in this lighter shaded blue color. So within our region, we are still seeing a lot of COVID cases. And it's shown here with the community transmission, a lot of red within our region for high COVID transmission. This is our COVID strain surveillance numbers from last week. This will be updated, I think, probably later today. So this is report 59 from last Tuesday. So there's really the highlight here is the BA2, the Omicron lineage went from 88 to 156. I think there's over 60 new cases that were identified with the BA2 sublineages. There's the BA2.12.1, which is a part of this lineage. We are continuing to see that particular lineage. And I know that the new report will also, for the first time, identify or detection of the BA4 and the BA5 lineages of Omicron will be in the next, that will be coming, the report that will be coming out, I think later today. So next week, there should be a row showing the BA4 and the BA5 lineages and the number. So just FYI. This is the CDC variant profile for the entire US. The couple highlights here, as I mentioned, the BA4 and the BA5 continues to increase in the detection of it across the US, and the BA2.12.1, I also mentioned, is decreasing or has decreased over time, and the BA4 and 5 have increased and continue to increase each week. So that's the latest numbers for the COVID variants across the US. This is the high risk chapter list. This is the green area here. There were 63 new chapters that made the list. Last week was 60. So 3 new chapters are part of this new COVID risk for chapters. And then as you go across to the right is over time. The number of chapters that make these lists. The list has increased over time as well. If you go over to the far right, this is going back 6 weeks. So these 16 chapters have been on this list for at least 6 weeks. And last, just some summary here. We are seeing a high number of cases, even though it's a minus 9% change compared to the previous week. We are still seeing a lot of cases. The 7-day case rate, as I mentioned earlier, is at 386 per 100,000. So high COVID risk and transmission currently. And I mentioned the report that will be coming out today. Later, we'll identify the four sublineages of the Omicron variant, and we'll show that going forward. The supplemental metric, the lab-based test positivity, is now at 27%. Then the hospital capacity for hospital beds, occupancy for regular remain below 80% and continue to remain stable, again, that is a good sign. So I am going to stop here, and I think I'm the last presenter. So we are going to end here, and thank you all for joining us. Have a great rest of your day. Thank you. Bye.